Does caffeine make medication side effects worse with schizophrenia? Have you ever wondered how caffeine affects those managing schizophrenia? It is a topic that deserves attention, especially for those navigating treatment. Caffeine can indeed influence both schizophrenia symptoms and the side effects of medications used to treat this condition. Let's break down how this works. First, caffeine interacts with brain chemistry. It blocks adenosine A2A receptors in the brain. Normally, adenosine helps to inhibit dopamine activity. When caffeine blocks these receptors, it increases dopamine activity. Since schizophrenia is linked to dopamine dysregulation, this increased activity can worsen symptoms like hallucinations or paranoia. This means caffeine could amplify medication side effects or psychiatric symptoms, complicating treatment. Next, consider how caffeine is processed in the body. The liver enzyme known as CYP1A2 metabolizes caffeine and many antipsychotic medications, including Clozaril, which is also called Clozapine. Caffeine acts as a competitive inhibitor of this enzyme. This means that caffeine can slow down how quickly these medications break down. As a result, caffeine consumption may raise blood levels of certain antipsychotics. This can increase the risk of side effects like sedation, dizziness, or other toxicities. Additionally, high caffeine intake has been linked to increased anxiety, hostility, and agitation in psychiatric patients. These effects can worsen the overall clinical picture for someone with schizophrenia. It is also important to note that withdrawing from caffeine can lead to fatigue and drowsiness. These symptoms can overlap with the side effects of antipsychotic medications, making it hard to tell what is causing what. Some studies suggest that caffeine might improve certain negative symptoms of schizophrenia or help with movement disorders caused by antipsychotic medications. However, these effects are not well established and may vary from person to person. For those managing schizophrenia, here are some practical tips regarding caffeine intake. Monitor caffeine consumption carefully, especially if taking antipsychotics metabolized by CYP1A2, like Clozapine. Educate yourself about potential interactions and side effects. If high caffeine consumption seems to worsen symptoms or side effects, consider gradually reducing intake. Communicate openly with healthcare providers about caffeine habits. This can help adjust medication dosages if needed. In summary, caffeine can worsen some medication side effects and schizophrenia symptoms by increasing dopamine activity and altering how drugs are metabolized. Careful management of caffeine intake is important for those undergoing treatment for schizophrenia.